So respiratory system. When we look at the respiratory system, we are going to be focusing very much on the zone 1 and zone 2 of the feet. So the toes and the ball of the foot. This is where the majority of our respiratory system resides. So first and foremost, when I'm going back, obviously we have done the whole reflexology treatment. And now we're going to go back to respiratory because they have some kind of acute or chronic illness to do with their lungs. Or it might be that during the reflexology, something came up that made you go, I want to go back to that area. So the first thing we're going to do is open up the diaphragm. And we do that by squeezing into the solar plexus and then pulling out across the diaphragm. All right. Push into the solar plexus and pull out at the diaphragm. We can also really encourage that movement. So back and forth over your thumb to really knock any kinks out of that diaphragm. Because if people have chronic breathing issues, they will not necessarily be using their diaphragm properly. Okay, so kind of pulsate that diaphragm a little bit. Let's really open it up. So I always do that to open up the diaphragm first. We are then going to look at the sinuses because the sinuses are all part of that respiratory tract. Sinuses, we are going to do it slightly different than we normally do. We're going to place a hand behind the toes and we're going to work downwards from the tip of the toe, and we're going to work all the way down and then almost push in to the bottom. At the pad at the top, work down to the pad, really push in. Pad, down, push in. Pad, down, push in. Repeat it again. The reason why you've got this here is so you can really support those toes when you're pushing down. When you push in the second time, I want you to bring it back up. Push in the pad, down, push in, bring it back up. Pad, down, push in, bring it back up. Pad, down, push in, bring it back up. Repeat that again. So we're going to be doing it 3 times, going along each of the toes, which is the sinus reflex. Okay, so that's the sinuses. I'm going to do it on the other side so you can see. Pad of the toe, go down, push in, pull up. Pad of the toe, push in, pull up. Pad of the toe, go down, push in, pull up. Pad of the toe, go down, push in, pull up. Repeat that. If you feel on the sinuses that there is a lot going on, then you can repeat this on the dorsal side, so on the top of the foot. So imagine we've done that 3 times. You can do it on the other side, so you need to put your knuckles there. You won't do the pad, but you will walk down, pad in, and then pull up. Walk down, push in, pull up. Walk down, push in, pull up. I would only really do that if I could feel in the sinuses or they had sinus pain, but if I felt them in the foot, then I would also do the front. I don't always do the front of the sinuses. The next thing is the trachea. So the trachea is where where the breath goes in, the oxygen goes down. So we've got this lovely tube that goes down, and that is from the pad of the middle between the big toe and the second toe. And we're going to walk that, kind of goes, it's a lovely trachea bit, and then it comes to the lovely lungs, all right? So we're going to push down and just work that motion on this side. And as always, I do it 3 times. You might find that there is something there that needs to be worked on, so go in with a press and a hold, that kind of thing. You can really kind of massage into it if you want to really open up that trachea, because without that trachea opening, you can't get any oxygen in at all. And then we would obviously work our lungs further. So we would normally do a thumb walk over, right, in our normal reflexology session. In this one, I do what I kind of do like a popcorn effect. I'm popping in and out, but I'm making like a snake-like motion. So I'm kind of going like that along the lungs. And this is just to open up the lungs, and it's to see if there's any crackly areas that I missed. We're using the supporting hand to really add to that pressure that we can create. So I do pop, 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 all over the lungs. Let's repeat that on the other side. Pop, 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 pop. You can use 2 thumbs, you can use 1 thumb, whatever feels better for you. But we are making sure that we're using the supporting hand to add to that pressure that we're adding. It doesn't all have to come from the thumbs, it can come from the fingers. Okay, and then the final one is the bronchioles. And the bronchioles we find on the front of the feet, much like we do with the lymphatics. And what we want to do here is hold the foot with both hands, and we want to almost like pull apart in these little valleys, these dips. We want to push and pull, almost as though we're trying to open up those bronchioles. All right. Push and pull, push and pull, push and pull, push and pull. So down each of these valleys, we want a motion that pulls it to the middle of the foot, and we want a motion that pulls it away from the middle of the foot, the outside of the foot. So middle pull, outer pull, middle pull, outer pull, middle pull, outer pull. Doesn't have to be hard because it's really thin on top. And again on this side, place the fingers there. We've got the middle pull, outer foot pull, middle pull, outer foot pull, middle pull, outer foot pull, middle pull, outer foot pull. And that is the sequence that we use for the lungs.